While the battle of the future of American healthcare system wages on Capitol Hill, some Americans are fighting for their own affordable care right now from their homes. Our Special Assignment Unit reporter Whitney Wild met one woman who falls into a gap in the healthcare system.
Medicaid has been expanding. It's one of the big stories of the Affordable Care Act. What's perplexing is that a Hyattsville woman says she was kicked off the program that she needs most. After we started digging, the Prince George's County Department of Social Services admitted it made a pretty major mistake. But is she the victim, or are you? Every morning, Andrea Levant is vulnerable, yet determined.
Good morning. Okay, push me. I go to work every day, and people have no idea what it takes for me to get there.
Andrea works full-time. Just to make it to her job, she relies on others.
Queen is in her throne.
She lives with a form of muscular dystrophy called spinal muscular atrophy. The effect is muscle weakness. She needs help to get out of bed in the morning and back into bed at night.
1, 2, 3. There we go.
Normally, she has a home nurse. Not today.
I literally cannot get out of the bed. And I mean, some people think, oh, you know, it's an optional thing, but for me, it's laying in the bed if nobody comes.
I was afraid I'm gonna wobble you over. Let me just lift the wheel. Get over this way.
Instead, she leans on her friend Josie Gilliland.
Do you want me to wet it first?
She can't reach across the counter to get toothpaste or, you know, grab things off of a shelf.
Josie rushed to Andrea's side after Andrea got a notice canceling the Medicaid coverage she'd had for 10 years. There was little explanation, no remedy for appeal.
So I can't completely panic, but at the same time, you're just kind of already trying to quickly forward think as to like what this could mean.
I always want to back you in.
Yeah.
Andrea says since 2007, the state of Maryland has given her Medicaid to pay for her home nursing. 5 hours a day, thousands of dollars every year. She has insurance through her job, but it doesn't cover this level of care. She showed us a bill outlining how much home nursing can cost. If she paid out of pocket, she'd only have a few $100s left over for food and rent.
Nobody had any answers for me whatsoever.
Andrea says she's dealt with years of confusion, noting the state denied her applications for Medicaid in the past, but says she was ultimately approved.
And I have to go to social services and say, you know, I don't know what I'm in, but I've always had Medicaid, and it would magically, I don't know, you know, what they would do. Oh my gosh.
We saw Andrea's frustration firsthand when she came to our studios to make a few calls.
I feel like I've called every number that is possible to call.
After about 40 minutes, she gave up.
Hey, can you hear me now? Hey, I'm calling. I'm trying to reach a Martin Smith. He's a medical care program specialist. Oh, you transferred me to Peter Smith. I'm looking for Martin Smith.
After we started making calls, officials started to open up a little bit. Andrea got a call that said she could have an appeals hearing. But before a date was set, she got a letter that said she could have Medicaid benefits until next May. Then she got another letter with a date for an appeals hearing here in Landover in front of a judge. His name is Michael Osborne.
Okay, do you understand the nature of your appeal and what?
This was the appeals hearing, the chance for officials to explain why they kicked Andrea off Medicaid.
In looking at it, in looking at the case, we did not use her income correctly or apply it correctly when processing the application.
That voice you hear? He was working on behalf of the Prince George's County Department of Social Services. He said he didn't want to be photographed at the request of management. So we used his voice instead, and he needed only a few words to say a lot.
So the medical assistance was based on zero income. And I'm saying that that was a department error.
A really big department error. See, when you apply for Medicaid, you have to tell your local Department of Social Services how much money you make every month. In this case, Andrea was working with the Prince George's County Department of Social Services. The magic number for her every month, $1,366. She couldn't make any more than that. Andrea does make more than that, and she was honest with them, but officials miscoded her as having $0 in income every month. That approved her for Medicaid. And that's why your tax dollars might have paid for her Medicaid, even though she really might not have qualified for it. She calls this entire experience frustrating.
I've called, I've gone in person, I've, done everything that I'm supposed to do.
Your wheel's catching on the battery.
I've built my life here based on these services that I've continued to receive, and now you cut them off in the middle of the year.
The judge has until early October to decide what will happen to Andrea. Meanwhile, she's left to navigate a complicated system on her own.
Without a caregiver, what are you giving up?
Freedom. Really what America is supposed to stand on.
We've been working on this story for months, and there's still a lot we don't know. For example, the state can't say how often cases like Andrea's happen because they say cases differ and often defy accurate comparison. We also don't know exactly how much the state paid out for her Medicaid benefits over the years. If it turns out the state should have never given her those benefits, she might have to pay that money back. The bill could add up to tens, if not hundreds of thousands of dollars. We'll update this story as soon as the judge issues his ruling. Whitney Wild, WUSA 9.